Mucormycosis, the black fungus. Many people suffer from fungal infections at least once in their lives. Poor hygiene, humidity, and warm climate are possible causes of fungal infections. Causes of fungal infections. 1. Hot and humid climates. Sweating too much or wearing damp clothes can cause fungal infections. 2. Compromised immunity due to underlying diseases like diabetes, HIV, cancer etc. can cause fungal infections. 3. Living in an unclean environment and not maintaining personal hygiene can cause fungal infections. 4. Wearing dirty clothes like unclean socks and innerwear can lead to fungal infections. 5. Wearing clothes that are too tight can cause sweating, further resulting in the development of fungal infections. 6. Obesity can lead to fungal infections. 7. Moisture can be retained in skin folds, further giving a breeding ground to fungus. 8. Stress can compromise our immunity, further leading to fungal infections. 9. Hormonal changes in pregnancy can lead to vaginal infections. 10. Using wrong type of soap. What is mucormycosis? Mucormycosis is a very rare infection. It is caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It is found in soil and air and even in the nose and mucus of healthy people. In other words, we can say, mucormycosis, an infection of sinuses, brain, or lungs or other areas informally known as black fungus. It is a fungus infection in the nose which results from COVID-19. The condition is a type of mucormycosis, which is a fungus infection causing a nasal infection. The most common risk factor among patients was diabetes. Doctors believe mucormycosis, which has an overall mortality rate of 50%, may be being triggered by the use of steroids. The infection can appear in the eyes. The infection appeared in India and Russia. Diabetes lowers the body's immune defenses, coronavirus exacerbates it, and then steroids, which help fight COVID-19, act like fuel to the fire. A person affected with mucormycosis may need early detection and powerful diagnosis for treatment, which may, in turn, affect other organs such as the kidneys. Cases. In Mumbai, 40 patients are suffering from the fungal infection in April. Many of them are diabetics. 11 of them had to lose an eye and 6 of them died. In Bangalore, there are 19 cases of mucormycosis in the past 2 weeks. In West Bengal, 5 patients are found with this disease, till now. 4 cases are found in Bihar. Symptoms. Patients suffering from the fungal infection typically have symptoms of stuffy and bleeding nose, swelling of and pain in the eye, drooping of eyelids and blurred, and finally, loss of vision. There could be black patches of skin around the nose. Also, they can suffer from headache, fever, cough, chest pain, shortness of breath, abdominal pain, nausea, vomiting etc. Steroids role. You all should know that steroid increases the infection and minimizes the inflammation. So if you are taking steroid, then be more careful and take precautions as much as possible. What viruses do in our body is, they enter in our body and start replicating. After replication, they directly affect to our immune system. If our immune system is weak, then they can't fight with the foreign body, viruses. Steroids reduce inflammation in the lungs due to COVID-19 and appear to help curb some of the damage that can happen when the body's immune system fights against the virus. But, they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic COVID-19 patients. How do I get black fungus? People catch mucormycosis by coming in contact with the fungal spores in the environment. It can also develop on the skin after the fungus enters the skin through a cut, scrape, burn, or other types of skin trauma. The disease is being detected among patients who are recovering or have recovered from COVID-19. Who can get mucormycosis? The fungal infection is caused by a group of molds called Mucormycetes. These molds live throughout the environment. Mucormycosis mainly affects people who have health problems or take medicines that lower the body's ability to fight germs and sickness. The high-risk groups for black fungus are COVID-19 patients, patients with uncontrolled diabetes mellitus, DM, type 2 DM, patients on high steroids therapy, patients receiving immunosuppressive therapy, and patients in ICU for a long time, on oxygen therapy and with high ferritin. Will rubbing alcohol kill skin fungus? Like hydrogen peroxide, rubbing alcohol can help kill off the fungus that's on the surface level of the skin. Home remedies for fungal infections. Most fungal skin infections can be treated with over-the-counter or prescription creams. Severe infections may require additional methods. Fungal infections are infections caused by a fungus, a type of microorganism. A fungal rash is often red and itches or burns. You may have red, swollen bumps like pimples or scaly, flaky patches. Though mucormycosis is not as simple as other type of fungal infections, still here are some home remedies to treat other type of fungal infections. As we all suffers from infections in our daily lives, so we need to know some home tricks to cure them. What can naturally kill fungus? Garlic, turmeric, aloe vera, coconut oil, soapy water, powdered licorice, apple cider vinegar, grapefruit seed extract. 1. Eat yogurt and probiotics. Yogurt and other probiotics have an ample amount of good bacteria that help stave off many fungal infections. Fermented foods are another excellent source of probiotics. 2. Use apple cider vinegar. Apple cider vinegar has antifungal properties. You could mix 2 tablespoons in warm water and drink it up, or dip a cotton ball in it and dab over your skin. Doing this thrice a day should produce beneficial results. 3. Use tea tree oil. Tea tree oil is naturally antifungal and antibacterial. Mix it with any carrier oil like coconut oil or olive oil and dab over the infected area about 3 to 4 times a day. 4. Use coconut oil. In its unheated form, even coconut oil works as a potent antifungal agent. Applying it over the skin makes it a good, safe topical medicine. It is also useful to treat scalp ringworm. Five. Garlic. Garlic is one of the most potent antifungal and antimicrobial herbs. Those who eat garlic regularly are less susceptible to fungal infections. Crush a couple of garlic with some olive oil and make a paste. Apply to the infected area for about 30 minutes. 6. Use aloe vera. One of the most time-tested natural remedies to cure any skin infection is aloe vera. It not only treats the infection but also soothes and repairs skin damage. 7. Use turmeric. Turmeric is a potent antimicrobial and anti-inflammatory spice. Mix with a little water and apply over the infected area. 8. Oregano oil. Mix a few drops with any carrier oil and dab on the affected area. You could also take oregano oil capsules orally. 9. Neem leaves. Neem leaves have effective antifungal properties and are extremely good for the skin. To make neem water, boil neem leaves in water for 2 to 3 minutes. Ginger. Gingerol present in ginger has potent antifungal properties. Adding ginger to our diet in the form of ginger tea effectively helps to prevent and treat fungal infections like Candida,